year for my ambulatory care assignment, I'm working in GI oncology. I'm really interested in oncology. And so I was there, and I was working with a resident, and we were taking a patient history, and the patient who was just diagnosed with colon cancer was telling us how she had 7 rounds of chemo with one particular regimen, and then she had 7 rounds of a different chemo with a different regimen. And the resident had thought that that was just 7 rounds of chemo and didn't take into consideration that we had 7 more. So this patient would have had 14 rounds of chemotherapy. So we went back, and the resident was telling the attending, like, this is what happened. This patient had 7 rounds of chemo. And I was thinking to myself, I was like, I didn't think that's not what I heard. And if it was maybe a couple years ago, if I hadn't had the patient safety training that I had this summer, I probably would not have said anything. I'm a medical student, I don't know anything. But because of all of my experiences this summer and the opportunity to work with such wonderful people and learn about patient safety, I felt empowered to say something. And I asked the resident, I was like, correct me if I'm wrong, but I really feel like I heard 14 rounds of chemo. She had 7 rounds of this regimen, 7 rounds of another regimen. And he was like, let me go ask the patient. So we went back and asked the patient, and the patient was like, yeah, so I had total 14 rounds of chemo. And the resident really appreciated that I pointed that out to him, and that I noticed it. And I felt really great about it. I felt like, as a medical student, I can bring a voice to the table. It doesn't matter where you are. When you see something, and there's a problem with patient safety, and you value that, you have to say something. And I felt really inspired and empowered this summer, so I'm so grateful for the opportunity to be able to share that with all of you, and also to the people that made it possible for me to have this experience. So I'm going to go with that and start my presentation, but before I start, I just want to thank my mentors, Dr. Seth Krevat, Dr. Kelly Smith, who were there with me the entire time throughout this presentation and this project. And without them, I don't think I would have been able to have such a wonderful experience.